ICD-11 Premenstrual Dysphoric Disorder, PMDD. Premenstrual dysphoric disorder is primarily located in the chapter on diseases of the genitourinary system, but PMDD is cross-listed in the subgrouping of depressive disorders due to the prominence of mood symptomatology. Premenstrual dysphoric disorder. During a majority of menstrual cycles within the past year, a pattern of mood symptoms, depressed mood, irritability, somatic symptoms, lethargy, joint pain, overeating, or cognitive symptoms, concentration difficulties, forgetfulness. The symptoms begin several days before the onset of menses, start to improve within a few days after the onset of menses, and then become minimal or absent within approximately 1 week following the onset of menses. The temporal relationship of the symptoms and luteal and menstrual phases of the cycle should ideally be confirmed by a prospective symptom diary over at least 2 symptomatic menstrual cycles. The symptoms are severe enough to cause significant distress or significant impairment in personal, family, social, educational, occupational or other important areas of functioning, and do not represent the exacerbation of a mental disorder. Diagnostic Requirements of Premenstrual Dysphoric Disorder. 1. During a majority of menstrual cycles within the past year, a pattern of mood, somatic, or cognitive symptoms. The symptom begins several days before the onset of menses, starts to improve within a few days after the onset of menses, and then becomes minimal or absent within approximately 1 week following the onset of menses. (1) The temporal relationship of the symptoms and luteal and menstrual phases of the cycle should ideally be confirmed by a prospective symptom diary over at least 2 symptomatic menstrual cycles. 2. The symptoms include at least one affective symptom such as mood lability, irritability, depressed mood, or anxiety. Additional somatic or cognitive symptoms such as lethargy, joint pain, overeating, hypersomnia, breast tenderness, swelling of extremities, concentration difficulties, or forgetfulness. 2. The symptoms are not better accounted for by another mental disorder, for example, a mood disorder, an anxiety or fear-related disorder. 3. The symptoms are not a manifestation of another medical condition, for example, endometriosis, polycystic ovary disease, adrenal system disorders and hyperprolactinemia. Not due to the effects of a substance or medication on the central nervous system, for example, hormone treatment, alcohol, including withdrawal effects, for example, from stimulants. 4. The symptoms result in significant distress or significant impairment in personal, family, social, educational, occupational or other important areas of functioning. Boundary with normality. mild mood changes, for example, increased emotional lability, irritability, subjective tension, that occur during late luteal or menstrual phase of the cycle for many women should not be labeled as premenstrual dysphoric disorder. In contrast to premenstrual dysphoric disorder, these symptoms are less intense and do not typically result in significant distress or impairment. Differential diagnosis. 1. Premenstrual tension syndrome, GA 34.40. Many women may experience cyclic emotional, physical, or behavioral symptoms that interfere with their lifestyles during the luteal phase of the menstrual cycle that are appropriately diagnosed and treated as premenstrual tension syndrome. This is in contrast to premenstrual dysphoric disorder, in which the symptoms are considerably more severe and cause significant distress or significant impairment in personal, family, social, educational, occupational or other important areas of functioning. 2. Other mental, behavioral or neurodevelopmental disorders including mood disorders that are exacerbated premenstrually. For example, mood symptoms characteristic of premenstrual dysphoric disorder including depressed mood, irritability, and anxiety can be present in other mental, behavioral or neurodevelopmental disorders, for example, depressive disorders, bipolar disorders, generalized anxiety disorder. Although symptoms of these disorders may be exacerbated during the late luteal and menstrual phases, premenstrual dysphoric disorder is differentiated by the absence of symptoms 1 week post-menses. Because of the difficulty in accurate recall of the relationship between menstrual cycle and the course of symptoms, prospective mood ratings for 2 consecutive cycles should be considered. (3) Dysmenorrhea. Dysmenorrhea is characterized by cyclic pelvic pain or lower, umbilical, or suprapubic abdominal pain preceding or accompanying menstruation that interferes with daily activities. Unlike premenstrual dysphoric disorder, the onset of dysmenorrhea is coincident with the start of rather than prior to menses. Furthermore, mood symptoms are not typically associated with this condition. 4. The effects of hormones and their synthetic substitutes and antagonists, use of hormone treatments, including for contraceptive purposes, may result in unwanted side effects that include mood, somatic, and cognitive symptoms. If symptoms do not persist after cessation of these medications beyond the period when their physiological effects should have subsided, a diagnosis of premenstrual dysphoric disorder should not be assigned. Comment and subscribe.